just move to this. Health Minister Zweli Mkhize says the department has precautionary measures in place should the coronavirus hit South Africa. Mkhize was speaking to journalists this morning, and our reporter Khali Khumalo was there, and he joins me now. Kai, thank you for your time.
Thank you.
Let's talk about some of the precautionary measures that perhaps the minister said they have in place. I mean, South Africa is worried. We already know of one case reported in the Ivory Coast, which we're also following closely as a continent. But in South Africa, what's the state of preparedness?
Well, the minister was very clear in his response to Melanie, saying that South Africa has really put a number of measures. For example, we have a national operation emergency center that has been set up right at the National Institute for Communicable Diseases. But also, more importantly, South Africa has been requested by the World Health Organization to serve as a reference center in terms of sampling to make sure that there is a very confirmed situation. So, for example, the Ethiopian authorities have sent about 4 samples to South Africa to make sure that they try and check and double check and triple check so that they really know if there is a case of coronavirus as well, after some 4 Ethiopian nationals were isolated.
Yeah, is there a reason for South Africans to be worried? Because I kept on hearing in the press briefing that, there's no need for panic, they're appealing for calm, but should we be worried not only if you are in South Africa, but for those South Africans perhaps who are even working at Wuhan or China?
Well, precisely. So the indication that you got from the minister was that there are about 35 South Africans who are right in this particular city in China that is an outbreak of this particular virus. And at this point, he's saying that the Chinese authorities, they're saying that they have everything under control. But of course, we know that, the situation is escalating. But then they say also, more importantly, once you have the symptoms of this particular virus, then you quarantine for a period of 14 days. So that's where you get treated. But also, more importantly, Dumelo, at this point, there is no vaccine that has been, just put aside for this particular virus. But they try to treat you, for example, for coughing, for, having shortness in terms of breath and stuff like that. So if you may just take a listen to the minister once again trying to put that point across.
Provinces have activated outbreak response teams and are on high alert to detect and manage inadvertent cases that may arrive in the country. Screening of returning travelers from China at major airports have been intensified. I'll also go into a little bit of details in this regard, as this is, of course, an area of paramount concern. Our port health officials routinely conduct temperature screening for all international travelers. Those of you who have been traveling abroad could have noticed that we have thermal screening, which is, conducted at a distance, and that everyone actually coming through from international travel gets subjected to this routinely as they land at the OR Tambo and the other airports. However, due to the current risk of importation of inadvertent cases of the coronavirus from Wuhan city, our port health authorities have intensified surveillance of all travelers from Asia.
Well, of course, the issue of travelling also coming into play there, Kaya, according to the minister. I mean, I can imagine that stringent measures have now to be taken, especially around, our international airports, Cape Town and OR Tambo, where anyone who travels from China to South Africa will also have to be tested.
Well, undoubtedly. And the minister gave an indication, Dumela, that at this point South Africa will not be restricting any flights from China. We've seen so many international flights, airlines announcing that they won't be flying to China. So at this point, South Africa will be letting planes from China to land here. But also, more importantly, there's another case that has been reported in Zambia. So the minister said they are monitoring that particular case. But also, more importantly, they are saying that South Africa does have some of the most state-of-the-art facilities. Of course, hence the WHO said there should be a reference point for any, just situation that may arise in the continent.
All right. Well, thank you so much, Kai, for this update. Our reporter, Khali Khumalo, joining us right here on The Rundown.